Welcome back to Afternoon Live. Stem cell therapy is frequently in the news, often described as anti-aging or regenerative treatments. Well, joining us is cardiologist and scientist Dr. Ernst von Schwarz, who says that researchers and clinicians believe stem cell therapy is one of the most promising advances in modern medicine. Hi, Dr. Ernst.
Hi, Kara. Thanks for having me on.
Well, good to see you and talk about this. You know, first off, share what stem cells are and what stem cell therapy actually is.
Well, stem cells is basically the beginning of everything, if you wish. Some people call it the God's cell, made by God. So in the embryonic states, the stem cells create basically our entire body. Every single organ is a specialized conglomeration of cells which come originally from stem cells. So stem cells can specialize and to develop into cells in your skin, into your liver, into your heart, your brain. Everything comes out from stem cells. So it's a universal cell, if you wish, which creates the entire organism.
So how does stem cell therapy work?
Well, the idea is to have a paradigm shift from what we call reactive medicine to now regenerative medicine. So as physicians, we see patients on a daily basis who come because of injuries or symptoms or some damage. So we react as doctors to that injury and that disease. Instead, what we want to do in the future, and we are doing in part already scientifically, is instead of just reacting to a disease, we want to repair the damage, regenerate damaged or dead tissue. And that's where stem cells come in, because stem cells have the ability to regenerate damaged tissue. They have the ability to create new blood vessels. They are anti-inflammatorily active, and they can rebuild in certain organs at least part of the lost organs and restore part of the lost function.
We're seeing their injections. Is that always what it looks like?
Well, it depends, yeah. I mean, many colleagues of us do injections like you see here, for example, for chronic joint degeneration, arthritis, for example, in the knees or in the hips, or orthopedics use stem cell injections for lower back pain because of the anti-inflammatory effects and the pain improving effects. And people who had damage of their joints, their muscles or their tendons, and who had stem cell injections, they know it does work. They feel much better. But there's other ways, of course, to go directly in the organs or even systemically. But keep in mind, Kara, that stem cell therapy at this point is not FDA approved. It's still under investigation, and we still need a lot of more clinical trial and study data before we can use it to a broader public, basically.
I want to get to the medical conditions that are likely to benefit, but as we touch on the FDA approved, what are the risks when you're talking about something that's not approved yet?
Well, the risk is we don't know what are the long-term effects. So, for example, some people believe that if you inject stem cells in people who have ongoing cancer, and we don't know about it, that might even generate more cancer cells. We don't know that. There's other researchers who want to use stem cells to treat cancer. I personally have not much experience in that, but in cardiovascular disease and coronary disease, after heart attacks and strokes and even vascular conditions like erectile dysfunction, we know that stem cells are very effective because they can rebuild new blood vessels. We call that angiogenesis, and by thus they can improve the blood flow to the damaged organs, and that in turn then can improve functions. In particular, vascular conditions can improve in the future, hopefully, if we have the approval from the FDA to use it and use stem cell therapies.
Since it's not approved yet, is it something that people need to seek out, look for the trials?
Absolutely. I mean, it will take years, of course, to get stem cell therapy approved, and it will not be approved in general, but for a certain disease condition, of course. And there's a lot of people who sell stem cell therapy without really clinical data or scientific data. And that's, of course, sometimes a little questionable. Without the frame of a clinical study, I personally would be careful and don't believe false claims of cure of certain diseases. That has never been shown with stem cell therapy, and that's what the FDA is looking at. On the other hand, all of us who have been involved in stem cell therapy believe strongly that that's the future of medicine. And there's a reason why the richest people in the world and the biggest corporation in the world fund stem cell companies. Bezos, the Amazon CEO, just is funding a lab which focuses on DNA repair and stem cell therapy. The companies Google and Apple a few years ago have put hundreds of millions of dollars into Silicon Valley biotechnology companies who focus on stem cell therapy for anti-aging, maybe even for immortality purposes.
Fascinating stuff. Dr. von Schwarz, thank you so much.
Thanks for having me, Kara. Good luck.
Absolutely, yes. And we'll have more information about Dr. Ernst on our website at k8cu.com, but don't go away. We will be right back.